and welcome to NHIA in a week where we give you the highlights in the authority. My name is Shanice Paul. Now to the headlines. President Mahama hypes National Health Insurance Scheme. NHIA Operations DCE clarifies free primary healthcare and Mahama Cares initiatives. And NHIA pilots cashless system. Now to our first story. The NHIA joined African leaders and global health experts at the historic African Health Sovereignty Summit in Accra. The event marked a defining moment in the continent's push to control its health destiny.
Speaking at the African Health Sovereignty Summit in Accra, President Mahama announced the government had uncapped the National Health Insurance Levy, generating 3.5 billion Ghana cedis for expanded health coverage.
Your Excellencies, ladies and gentlemen, here in Ghana, we have not stood still. We have uncapped our National Health Insurance Scheme financing, opening a fiscal space of about 3.5 billion cedis more for broader and deeper health coverage.
The summit themed the Accra Initiative, Africa Health Sovereignty in a Reimagined Global Health Architecture, brought together African leaders and global health experts to advocate for reforms in governance and financing. The president highlighted other innovations, including the Ghana Medical Trust Fund and the soon-to-be-launched free primary healthcare policy. Health Minister Kwabena Mintah Akando emphasized that robust health systems are crucial for national stability, while World Health Organization Director General Dr. Tedros commended Ghana's investment in the NHIs as an exemplar of health sovereignty in action.
The responsibility for financing strong, resilient health systems rests with governments. The most efficient and equitable source of health financing is the national budget. Ghana is leading by example. Earlier this year, the Parliament passed reforms to increase financing for the National Health Insurance Scheme, filling the gap left by donor withdrawal and delivering on the President Mahama's bold commitment to free primary health care for all. That's what sovereignty looks like. And thank you, Mr. President.
NHI Chief Executive, Dr. Victor Asari Bampo, said the additional funding will expand NHI's coverage and reduce out-of-pocket costs. The summit ended with the adoption of the Accra Compact and the launch of the Sustained Initiative to promote domestic health financing.
Still on the African Health Summit, President John Dramani Mahama reaffirmed his commitment to strengthening the National Health Insurance Scheme. He called it the nation's pathway to achieving universal health coverage by 2030.
Led by Chief Executive Dr. Victor Asari Bampo, the NHIA took part in high-level discussions hosted by President Mahama. The summit aimed to reform global health governance and strengthen Africa's ability to finance and manage its health systems. President Mahama used the platform to unveil the presidential high-level task force on global health governance and the Sustained Initiative. He called for Africa to shift from a state of dependency to one of leadership in health matters. Dr. Bampo outlined Ghana's progress, citing increased NHI's funding from the removal of the fund cap, strategic spending on critical services, and stronger accountability systems.
So the president was talking about how he was uncapping of the National Health Insurance Fund. When he removed the cap, and that was one of the first things he did, we had an extra 3.5 billion cedis, which so there was more money. But the point is that we are driving more efficient use of the resources. So it's both about the quantum of the resources, and it's also about efficient use of the resources.
The Minister of Health urged African countries to invest in their own systems and keep the promises of the Abuja Declaration.
The Deputy Chief Executive of Operations of the NHIA, Dr. Kwesi Senanu-Jokoto, has shed light on the government's flagship health initiatives. He said they will close key gaps in chronic diseases care and push Ghana closer to universal health coverage.
Speaking at the Ghana College of Physicians and Surgeons, Dr. Kwesi Senanu-Jokoto stated that the Ghana Medical Trust Fund and the Free Primary Healthcare Policy will expand preventive and chronic care services. He revealed that NHI's coverage currently stands at only 56%, but uncapping the fund has increased the budget from 7 billion Ghana cedis to 10 billion Ghana cedis. A representative from the Ministry of Health reaffirmed the government's commitment to reforms that strengthen access and equity. The focus, he said, is on sustainable financing, efficient resource use, and bold innovation in service delivery.
Moving on, the NHIA began piloting a cashless payment system in 4 districts. The move is part of efforts to improve efficiency and reduce risks in financial transactions.
The pilots, launched on August 1, covered Waja, La Satellite, Ga Amasaman and New Jabin. Using the yet another modern membership system, YAMS, members can now pay via mobile money with electronic receipts issued. NHIA's acting manager, George Horty, described the system as fast, secure, and sustainable, while acting principal manager, Leslie Israel, said the process takes only 30 seconds. Senior manager of regional and district accounting operations, Eric Yeboah, stated that the system will enhance revenue collection, improve compliance, and reduce banking costs.
This application is going to help finance as far as our financial operation is concerned, in a sense that it is giving us an advantage which hitherto compared to the receipts we are not getting. One, we are going to maximize the collection of our revenue. And then two, with this system, we are also able to comply with financial management regulations, because the regulation mandates every district collecting monies on behalf of the authority to bank the revenue within 24 hours.
District officers have been tasked to educate members ahead of the nationwide rollout.
What I will urge all the district officers to know is that this solution, it has come to stay, and we want to urge them to educate our members, because when the education doesn't go down well, it will defeat the purpose.
To our final story, a hearing-impaired NHIA Principal Administration Assistant in Pusiga has won praise for his outstanding work. His dedication has made him an inspiration to his colleagues.
Atubiga Stanley joined NHI in 2012 as a volunteer for 1 year with the Boko District Office before becoming a data entry clerk, and was transferred to Pusiga District in 2018. Despite his hearing impairment, he handles most of the district data entry work with exceptional skill and minimal supervision. Public Relations Officer Kambo Abu Eric described his work ethic as unmatched and says Stanley never disappoints when assigned challenging tasks. His story is a testament to the value of inclusion and empowering individuals with disabilities in the workplace.
See me rough off. I don't understand. I hope you've been taking your medication. I do better. Hey, foul. And I say, be Pedro board damn.
Hello, ma.
Hello.
Good afternoon.
Good afternoon.
My name is Adam from National Health Insurance Scheme. I'm here with my colleague and would like to talk to you about the new NHIS app.
Oh, so you people are here to test my faith in you. Listen, let me tell you, there's no power above or beneath that can compete with the supernatural. There's no better health insurance than being kept by the power. And I'm kept by the power. And my whole family is covered. Oh, all they have to say.
No need to worry, Ghana. At the power of you, with over 500 medicines to take care of you, the new NHIS app has you covered. All you need is a valid Ghana card to register for yourself and for others. My NHIS app gives you access to credentialed health facilities and services across the country. Access to healthcare just got easier.
Download the My NHIS app to register yourself, your family, and your loved ones. Yes! You can register and renew NHIS membership for others too. All you need is a valid Ghana card. The new NHIS app gives you access to credentialed health facilities and services across the country with an extensive benefits package. Access to healthcare just got easier. National Health Insurance Scheme, your access to healthcare. Download on Google Play Store or Apple App Store. Terms and conditions apply.
That's all that we have for you in this week's edition of NHIS in a Week. For more story, do visit our website www.nhis.gov.gh or do visit our various social media handles displayed on the screen. My name is Shanice Palm. Do have a lovely week.